If you've saved over $2 million for retirement, there is one critical mistake that could blow up your entire legacy plan, and too many wealthy retirees are making it. The latest data shows that even well-prepared families are wildly underestimating healthcare costs, and it's costing them hundreds of thousands. Even worse, the fallback strategies most people rely on don't hold up when the real bills start coming in. In this video, I'll show you what retirement healthcare really costs in 2025, why your current plan might not hold up, and 3 strategies that actually protect your wealth when health issues strike. Let me ask you a question. How much do you think you'll spend on healthcare throughout your entire retirement? Take a moment and pick your number. If you've saved well for retirement, you probably guess somewhere between $50,000 to $150,000 total. And if that's what you guessed, you're not alone. But the actual number might surprise you. A 2024 study revealed that a healthy 65-year-old couple retiring today will spend approximately $395,000 on healthcare costs throughout retirement. And that's just for a healthy couple with no major health issues. So, if you saved $2 million for retirement but haven't planned for real healthcare costs, that $395,000 is coming straight out of your savings when bills hit. That's more than most people's entire house. But here's what makes this even more dangerous for families with significant wealth. They spend years planning around taxes, markets, and lawsuits, but often ignore healthcare. Boston College research found that people with substantial assets consistently underestimate this risk. Only 35% worry about major illness, yet 68% experience one. Just 32% are concerned about long-term care, but more than half end up needing it. And if healthcare isn't built into the plan, it can quietly erase the legacy you've worked a lifetime to protect. Let's break down what healthcare actually costs right now, because these numbers are climbing every single year. Nursing home care. $114,665 annually for a semi-private room. $131,583 for a private room. Home healthcare. Around $5,700 per month for full-time care. Assisted living. $70,800 annually on average. And remember, these are today's costs. Healthcare inflation runs about 5 to 7% annually, much higher than general inflation. Look, if you are realizing your plan has some real gaps, you are probably right, especially when it comes to healthcare. One big medical bill can blow up everything you worked for. That's exactly what we help people catch and fix before it becomes a problem. If you want to walk through your numbers, see what you are exposed, and get a plan to protect what matters, just use the link below to schedule a time. It takes about 45 minutes, and I promise you'll walk away with real clarity. No pitch, no pressure, just answers on your real healthcare exposure. Now, I know what you are thinking, but I'll have Medicare. That covers healthcare, right? This is exactly the trap that catches wealthy retirees. You're banking on Medicare to protect you, but Medicare is designed to cover the basics. So what does it actually cover? Well, let's say your spouse develops dementia and needs memory care. Your family assumes Medicare will handle it because it's a medical condition. The reality, Medicare only covers skilled nursing for a maximum of 100 days and only after a qualifying hospital stay. Extended help with bathing, eating, or dementia care, that's completely on you. Medicare covers basic doctor visits, hospital stays, and some prescription drugs. But here's what it doesn't cover, and this is crucial. Long-term care, custodial care, the biggest healthcare expense most families face. Dental, vision, and hearing. These minor expenses add up to tens of thousands. Premium increases. This is the hidden wealth killer. Relying on Medicare for long-term care is like relying on flood insurance you never bought. You don't realize you need it until the basement's already flooded. And by then, it's too late. Here's something that will surprise you. Medicare Part B premiums have grown 70% faster than inflation over the past 20 years. For wealthy retirees, it gets worse because of something called IRMA, Income-Related Monthly Adjustment Amount. If your income from 2 years ago exceeded $106,000 as an individual or $212,000 as a couple, you are paying premium surcharges in 2025. These aren't small adjustments. They can add hundreds of dollars to your monthly premiums. For example, If your income was $300,000 in 2023, you could be paying over $500 monthly just for Medicare Part B now. That's $6,000 per year on top of regular premiums. This 2-year lag is exactly why strategic retirement income planning is so important. Decisions you make today about IRA distributions and Roth conversions will impact your Medicare cost 2 years from now. And this is why you also need to stress test your plan with your advisor. Model healthcare costs rising at 5% annually and structure your income to minimize IRMA surcharges before it's too late. But the real Medicare shock is long-term care. Most people think Medicare covers nursing home care because it covers some skilled nursing. The reality, Medicare covers skilled nursing for a maximum of 100 days, and only if you meet strict requirements. After that, you are on your own. Every month of nursing home care, $9,500 to $11,000 comes directly out of your assets. So when someone tells you, don't worry, you have Medicare, remind them that Medicare is like having basic insurance on a luxury car. It covers oil changes and minor repairs, but when you blow the engine, and you probably will, you are on your own. The question isn't whether Medicare will help, it's whether you can afford what Medicare doesn't cover. When I share these numbers with clients, they always give me the same 3 responses. We'll just spend down to qualify for Medicaid. We can always use our home equity, and our kids will take care of us. Let me show you why each of these is a dangerous fantasy. First, the Medicaid spend-down strategy. Here's a scenario that plays out constantly. A family with significant assets assume they can eventually qualify for Medicaid if healthcare costs get overwhelming. But here's what most wealthy families don't understand. Medicaid isn't a safety net for people with assets. It's for the impoverished. You need less than $2,000 in countable assets in most states, plus strict income limits, typically around $2,800 monthly for individuals. Imagine you're receiving $4,000 from Social Security and pensions, which is common for well-off retirees. You don't qualify, period, no matter how much you spend on care. The research shows that only 15% of households with significant assets actually end up on Medicaid, despite 60% thinking this is their backup plan. Even if you could spend down, do you really want to limit your care options to what Medicaid allows? The better approach? Don't make Medicaid your plan. Make it a scenario you've accounted for, not the one you are relying on. Second, using home equity. The research found that over 40% of wealthy retirees do end up tapping their home equity for healthcare costs, but only 30% plan to do this. Picture this common scenario. Someone needs care immediately and the family gets a call. Suddenly, it's can we sell the house or should we take out a home loan? Now you are making major financial decisions under stress, often during a health crisis. Here's the problem. By the time healthcare costs force you to tap home equity, you are often making desperate decisions under pressure. You might be selling during a down market or taking out expensive loans when your income has already dropped. Plus, that home equity was probably part of your legacy plan. Now it's gone. Third, counting on family care. Yes, family members provide the majority of care hours. But here's what's changing. Your children likely live farther away than previous generations. They have their own careers and financial pressures. And honestly, do you want to burden them with intensive caregiving while they are trying to raise their own families and save for their own retirement? The research shows that demographic changes are making family care less reliable, not more. So what are the real strategies that work for wealthy families? Strategy number 1, trust-based asset protection. Don't make Medicaid or desperation your plan. Instead, explore trust-based strategies that can protect your wealth over time. Income-only irrevocable trusts and Medicaid asset protection trusts can shield assets from healthcare costs while still generating retirement income. This allows you to maintain your lifestyle while protecting your legacy from being consumed by care costs. Strategy number 2, comprehensive healthcare funding. Create a multi-layered approach that gives you flexibility and tax efficiency. First, establish dedicated healthcare buckets. Set aside taxable funds specifically for care. No tax surprises when you need access. Second, consider hybrid long-term care insurance. These policies provide coverage if you need care or a death benefit if you don't. Third, explore strategic home equity plans. Not necessarily reverse mortgages, but options like downsizing or HELOCs can free up liquidity without selling retirement assets. And strategy number 3, tax-efficient healthcare planning. Here's what most people miss. Emergency healthcare decisions create terrible tax situations. Imagine you need $100,000 for urgent care. If it's all sitting in your IRA, you are also triggering a 5-figure tax bill, right when you are least able to handle it. Work with your advisor to structure your retirement accounts and income streams for tax-efficient healthcare access. Minimize IRMA surcharges and explore Medicaid planning thresholds in your state, not to qualify for Medicaid, but to understand your true exposure and plan accordingly through HSAs and other vehicles. And if you need help with this kind of planning, feel free to reach out to us too. The bottom line is this: hope is not a strategy. Wishing healthcare costs won't affect you is not a plan. And assuming government programs will save you is a fantasy that could cost your family everything you've built. You need real strategies based on real numbers, implemented before you need care. You've now seen why relying on Medicaid is risky. But what if you could legally protect your assets and still plan for long-term care? Watch this video where I break down 5 specific types of irrevocable trusts that wealthy families use to shield their wealth from Medicaid without giving up income or flexibility.